no question that our healthcare system, although we boast about it, is not up to par. We need to do three things. First of all, we need to introduce accountability into our healthcare system. We need to introduce transparency, and we need to see some efficiency. And let me talk about, first of all, transparency. What I would like to see is that every patient, before they leave their clinic or the emergency room or they're discharged from a hospital, that they get a receipt, and the receipt shows what services were provided and how much OHIP was charged for. I believe that is the beginning of accountability, because I believe in Ontarians, and I believe when you see what you're being charged, what the system's being charged, you'll think twice about going to the emergency ward for a sniffle. You'll wait until you go to the clinic on the Monday morning. With regard to accountability, my friends, there is so much bureaucracy still in our healthcare system that it is unconscionable. And I believe that it's going to take some courage on the part of the Premier of the province to start stripping away that bureaucracy and holding people accountable. And finally, in terms of delivering of healthcare, we need to become creative, and we need to take the politics out of healthcare. And regardless of what people may accuse us of doing, of bringing private sector investment into healthcare, as leader, as the Premier, I would say let's open the doors. And a good example is the Sudbury Hospital in Thornhill, delivering the best healthcare services around the world for 5 generations. Guess what? Constructed, built, managed by the private sector, paid for by the OHIP card, and people come from all over the world to access those services. We need MRI clinics. We need breast screening clinics. We need mobile units to go across northern Ontario, funded by the private sector, paid for by OHIP, and we will have the best system in the world.